Okay, our next speaker is Norman Stewart from Merck Animal Health in the US, and he's going to talk about the comparison of two macrolides in the control of bovine respiratory disease in cattle ranch cattle.
Thank you. Everybody doing all right? Can you hear me with this? Yep. Okay.
Or I can use the one in the mic.
Yeah, we'll just work this. What I'm going to do today is review some field trial results from a study we conducted, and it was a comparison of two macrolides in the control of BRD and calf ranch cattle. The objective of this study was to determine the health performance of calf ranch cattle at a high risk for developing BRD after the administration of two different macrolides for the control of respiratory disease. This is a randomized clinical trial. It was conducted at a commercial dairy operation in the western U.S. It's about an 8,500 head dairy that has their own calf ranch on site. We utilized Holstein heifers, 2,059 of them. Their weight coming out of the hutches was 165 to 240 pounds, and those are the weights they were enrolled at. These cattle were determined to be high risk for bovine respiratory disease. The BRD incidence in this calf ranch with no previous injectable control agents was 20%. And prior to this trial, that 20% incidence is what they had, but that was also with chlorotetracycline in the feed. For this trial, we took chlorotetracycline out of the feed because we didn't want it as a confounding error. When the animals came out of the hutch, the same day they came out of the hutch, they were roughly plus or minus 60 days of age. Each animal was individually weighed. Their temperature was taken. They were individually BVD PI tested and administered a randomly allocated antibiotic. And then they were placed in a randomly assigned pen. And one of the things we did while we wanted individual weights of these animals was we wanted to get the proper dose of the antibiotic in the animal. And just to share a little highlight, the veterinarians, there's a group of 4 veterinarians who worked on this trial. And when the animals came through the chute to weigh them, people were guessing weights, and I'm glad we weighed them because there's probably a 30-pound variance when you looked at people just eyeballing and guessing weights. So it was nice to have the individual weights to get the proper amount of antibiotic in them. The veterinarians administered the antibiotic themselves. It wasn't done by workers at the dairy. The 2 treatment groups we used for this trial were Tildipirosin, 4 milligrams per kilogram, sub-Q 1 time in the neck region with a 3-day post-metaphylactic interval. Tulathromycin was the other control agent that we used, treatment group, 2.5 milligrams per kilogram, sub-Q 1 time in the neck with a 3-day post-metaphylactic interval. And while we had this 3-day post-metaphylactic interval, if the workers on the dairy who were overseeing this trial, if they thought an animal was sick during this 3-day PMI period, they contacted the veterinarians, and the veterinarians came out and examined the animals. Animals were placed in equal-sized pens. We had a maximum of 55 head per pen and 2 adjacent paired pens per replicate with 22 replicates on test. So to give you an idea, the dairy operation, if we had a row of hutches, it was roughly 100 hutches or 100 animals. And the whole row was taken, the animals were processed, they were randomized prior to receiving our treatment, they knew what they were going to get. They were processed and placed in the adjacent pens and based on their treatment group. And like we said, 1,030 animals received the Tildipirosin upon enrollment, and 1,029 received the Tulathromycin upon enrollment. Workers observed the animals daily for clinical signs of respiratory disease. The workers were blinded to the treatment and trained to uniformly score clinical signs. And BVD PI positive animals were removed from the study. And there were 5 of those animals in the study. They were removed and humanely euthanized. When an animal in either treatment group, is identified as sick with BRD, after its 3-day PMI, it was treated with 40 milligrams per kilogram of fluorphenicol, and this product also had 2.2 milligrams per kilogram of fluniximab in it. The dose was 6 cc's per hundredweight sub-Q we had in the neck region. And we put a 4-day post-treatment interval on it because the fluorphenicol has 4 days duration of therapy in this specific product. Clinical signs used to diagnose the BRD included nasal and ocular discharges, respiratory rate and character, presence and character of cough, their demeanor, how depressed they were, how they responded to sounds, and gauntness. And there was a specific criteria that for each one of these, gave examples of it that the workers were trained on. Animals with 1 or more signs were assigned a depression respiratory score. 0 was normal, 1 was mild, 2 was moderate, 3 was severe. So each animal, if they broke with BRD, was given a depression score and a respiratory score. All the animals, we had animals were weighed off test at 42 plus or minus days, and the reason there might be a variance of a day was they didn't weigh them off on Sundays. So when they were weighed off test, all the animals in the replicate with a set of paired pens were weighed off test at the same time. If we look at the results of this, there was a statistical difference of P equal 0.032 with regards to morbidity following the administration of the respective treatment groups for the control of BRD. So 95 animals, or 8.46% of the animals treated with Tildipirosin broke with BRD, compared to 128 or 11.43% of the animals that received the Tulathromycin. When we look at other factors we measured in this trial, there were no statistical differences, P less than or equal to 0.05, between the 2 treatment groups with regards to respiratory scores, depression scores, treatment success rate following the treatment with the combination fluorphenicol, flunixin, megumiline product, mortality, chronics, relapses, or body temperatures. So the bottom line was this: a conclusion was made. This demonstrated that treatment with Tildipirosin was superior to Tulathromycin in reducing bovine respiratory disease morbidity, with both antibiotics having a 3-day PMI when used to control BRD in calves. And one thing I should mention also, these animals, when they got their controlled dose, the average number of days to break for BRD with all these animals on trial was 17.3 days to 17.7 days, depending on the treatment group. But again, no statistical difference with that. With that, I'd like to say thank you for your time, your attendance, and any questions?
Okay, we have time for a few questions. So overall, you got statistical changes in maybe 1 or 2 parameters, but not in many.
Statistical differences were in the morbidity, and that was it.
Okay, and
P of 0.032.
So it's not a huge treatment effect, if we were to go on what we heard from the first speaker.
Right.
So could you maybe say a little bit more about that?
Well, when we looked at it, one of the reasons is dairy wanted to utilize this. They had run about a 20% incidence, sometimes as high as 25%. And I should say this trial was conducted from September to March during the year, so we had our temperature fluctuations. They wanted to get away from the CTC in the feed, or the chlorotetracycline, in the feed, when they took them from the transition from the hutch to the calf to the transition pens. So we looked at these 2 products, and one of them, needless to say, is one we have at Merck Animal Health. Another was one they were looking at, and they just wanted to evaluate this. We were hoping we'd see an effect with the morbidity, and with no differences in the respiratory scores, the depression scores, that showed us we had a fair trial in our mind. We weren't slided, we had a fully randomized trial. Didn't surprise us that we didn't see some of the differences in the other. They're both very good products, both therapeutically act in similar matters. There's a little difference in them structurally, and we look at MICs, days above the MIC, there's a difference between the products based on what's in the Freedom of Information when they got their approvals. But, we saw the morbidity, and that's, to the producer who owns this operation, that was important to them.
Okay. Any other questions? Go ahead.
Yes, sir.
Yeah. I'm interested in the product. Michael McGowan, University of Queensland. What's the duration of MIC? Is it similar to Tulathromycin?
With Tildipirosin, based on the work we have done in laboratories, we'll have, and if you look at the FOIs on both products, we'll have a higher number of days above the MIC based on laboratory work when we're looking at MICs compared against Pasteurella, Multocida, Mannheimia hemolytica, H. somnus than the other product does. But I would say if you go to the Freedom of Information, you'll see that. I don't want to get this into, one product versus another. But, those were laboratories. So this gave us a real good example of how many days in actual real world were we till we saw breaks with the BRD. And we were at 17. Now, the bacteria involved in this trial, because every animal that died in the trial had a full necropsy done by the state diagnostic lab. The animal was taken in. We saw Pasteurella multocida, Mannheimia hemolytica. We had mycoplasma. We had Salmonella Dublin. So we had, the Pasteurella multocida, Mannheimia hemolytica, and the mycoplasma were the big bacteria we saw in the trial. But with regards to your MIC, if we look at the literature, you'll see some differences in them. And
do you have any thoughts on uses other than for treatment of BRD? Because these products with long effective MICs are incredibly useful in situations where repeated treatment of animals is problematic. So a lot of the extensive rangeland beef operations I work with, we get to treat them once. So any thoughts on other therapeutic uses?
I can share with you what the veterinarians tell me that they've seen, and I'll specifically go to this operation because they've stayed since this trial was run. They have stayed using the Tildipirosin for a control agent coming out of the hutch. And this is just anecdotal evidence. There's been no trials done or anything like this, and it's an off-label use of the product, and the product's not approved for it, but they're saying their foot rot issues have virtually, been reduced. Pink eye issues have been reduced. We know where we have our label claim from. We know practitioners out there in the industry, clinicians, will see other uses for these also and try them. But have we done trials like for any of that? No, sir, we haven't.
Thank you very much.
Yes, sir.
We have time for one more question. If I could just ask you a question about the practicalities.
Mm-hmm.
How many trials like this would Merck have underway at any one time? Because it seems to me the logistics around this are amazing.
I'll be very honest with you. We ran this trial and haven't run another one for the last couple of years, but we have trials ongoing that I can't talk about right now. But, we're always looking, when we're looking at our agents, our therapeutic agents, other ways to use them, whether it's a new label claim, extended label claim, what information we can generate for clinicians and the practitioners out there. In fact, to give a perspective, last 2 weeks ago we had a meeting where we spent 3 days just going over proposed what we call life cycle medical field trials with our product portfolios, being pharmaceuticals or biologics. So a lot of time and effort dedicated to that, and one of our keys, and relates back to Dr. Fate, we're looking for good sites, and that's the one thing when we set this trial up. We knew what our objective was, but our first objective is find a site where we can get a fair trial run, get it set up right, have veterinarians involved, and do the basic things right, so whatever the results are, we know we can believe them.
Great. Okay, thank you very much.
Thank you.
Okay.
Appreciate it.